Well, my friends, nowadays the chronic kidney disease or damage of the kidney, failure of the kidney is day by day increasing. Persons suffering from chronic kidney disease anywhere now and then. The one reason, uncontrolled hypertension, and another cause is taking excessive painkillers. Excessive painkillers and hypertension damages the kidney. Now, how damages the kidney? That is a process, normal mechanism of kidney that has been destroyed. This is a patient, age about 37 years, already damaged his kidney. The creatinine level is now about 10 milligram after dialysis. Twice in a week, he is used to dialysis, and even then, even after the dialysis, creatinine becomes 9.07. This is the dialysis center, Government of West Bengal, Department of Health and Family Welfare, Beliagata, ID and BG Hospital. Now the question arises, he has come to us, many patients every day coming to us for impairment of kidney functions, to relieve, to discard the dialysis. But at that level, it is quite impossible totally stoppage of dialysis process because the kidney function is totally destroyed. One of the causes of kidney function destroyed is hypertension. In our society, we have observed from the very beginning, from the childhood, the parents used to mix salt, table salt, in the diet of children. বাচ্চাদের লবণ খাওয়াতে শেখায় মায়েরা। লবণ খাওয়াতে শেখায় তো? And that children is become the victim of a addicted child to take salt. পরে লবণ ছাড়া আর কোনো খাবার খেতে পারে না, কোনো খাবারের টেস্ট পায় না। So salt consume is the main factor since childhood. After that, the taking of painkillers, allopathic painkillers, kidney ke damage kore. And third point is hypertension. Hypertension or high blood pressure damages the blood vessels in the kidneys, reducing blood flow to the organ and impairing its ability to filter the waste products like creatinine from the blood, leading to elevated creatinine levels, which indicates a decline in kidney functions. So essentially, high blood pressure causes the chronic kidney disease, my friends, which is often reflected by the rising of creatinine level. So the kidneys are particularly susceptible to damage from high blood pressure due to delicate network of blood vessels within them. তোমার তো হাই ব্লাড প্রেশার ছিল। This patient is a victim of high blood pressure for which the kidney is damaged. When kidney function is compromised, the GFR, glomerular filtration rate, which measures how well the kidneys filter the waste products, decreases, leading to higher creatinine levels. So this is a picture of kidney. I am showing my friends for the general public of the society. The kidneys are two reddish brown bean-shaped organs like the bean, situated at the posterior part of the abdominal cavity behind the peritoneum. And this kidney, from the kidney, hilum of the kidney to pipes coming downwards, which are known as ureter, and these ureter enters into the bladder. So these are the vessels of the kidneys. These are the renal artery, which comes from the abdominal aorta. This is known as abdominal aorta. From the abdominal aorta, the blood circulation enters into the kidney by the name renal artery. Enters into the kidney. And the venous blood, deoxygenated blood, the impure blood, I mean the carbon oxygen containing blood, is returning, coming back from the kidney by the two veins known as the renal veins and enters into the inferior vena cava, the great veins of the abdomen. So in short, this is the anatomy. Now, I do like to focus about the functions of the kidney, why the kidney becomes damaged. So we have understood that kidneys are two bean-shaped organs lying on the posterior abdominal wall on each side of the vertebral column. They extend from the level of the 12 thoracic vertebrae above up to the third lumbar vertebra below. The right kidney is usually slightly lower than the left, probably due to the considerable amount of space occupied by the liver. Now I have shown you the two ureters which coming downwards from the kidneys, two ureters which convey the urine from the kidneys. They start from the pelvis. The part of this kidney is known as the pelvis. So they begins from the pelvis of each kidney and opens into the urinary bladder. Each ureter is about 25 centimeter long and made by fine muscular tube lined with mucous membrane. They convey urine by the peristaltic waves from the kidneys to the urinary bladder. And this urinary bladder, I am showing a good picture of urinary bladder, my friends. And this is the picture of urinary bladder. The urinary bladder, where the urine is temporarily stored or reserved. It is the place for temporary reservoir of the urine. It is a triangular shaped muscular bag. In fact, it is a triangular shaped muscular bag situated at the pelvic cavity. The lower portions of the human body, abdomen, is known as the pelvic cavity. There are three cavities in the human system. One is cranial cavity, one is thoracic cavity, and another is in the pelvic cavity. So, behind the symphysis pubis, the bladder lies. The neck of the bladder has a sphincter muscle to stop the backflow of the urine from the bladder. That's a backflow na hote pare. On urethra. Now, on urethra is coming out from the bladder, which discharge the urine from the urinary bladder to the exterior. In case of male and female, the roots are separate. So, this is about the anatomy of the kidney system. Now, what is the physiology? Why the kidney becomes damaged, my friends? Each kidney is made up of about 1 million long, narrow, tube-like structures called the nephrons. This is a picture. Inside the kidney, there is about 1 million long narrow tube-like structures called the nephrons. So nephron is the structural and functional unit of the kidney. So nephron is a tubule which is closed at one end and the other end opens into the collecting tubules. The closed end is cup-shaped called the glomerular capsule. The glomerular capsule enclosed network of arteries, capillaries called the glomerulars. The remainder of the nephron, named as proximal convoluted tubule, loop of Henle, and distal convoluted tubule. The distal convoluted tubule leads into the collecting tubule, and the filtration takes place through the glomerular capillaries. This is another fine picture to show the glomerular capillaries, my friends. So, urine excreted is the result of three basic processes. Number one, filtration. Number two, reabsorption. And number three, secretion. So the essential function of the kidney is to remove from the body waste products formed during metabolism. One of the common waste products is known as creatinine. Another is known as urea. So one of the most important functions of the glomerular filtration is to prevent the proteins in the blood from leaking through. Thus in health, no albumin protein comes out from the urine. So when the protein comes out, the condition is known as proteinuria or albuminuria. Now our subject is the not passing of creatinine which enters into the blood. So painkiller medicines are also responsible, like the taking of salt and hypertension. Certain painkillers, particularly non-steroidal anti-inflammatory drugs, in short, in abbreviation known as NSAID, like ibuprofen, naproxen, for long periods of time or in high doses can damage the kidney. This condition is known as analgesic nephropathy. This is because they can affect the blood vessels within the kidneys. They affect the blood vessels within the kidneys. So it damages the kidney. So ultimately, the patient becomes a victim of dialysis, my friends. So, however, in homeopathy, we always treat the patient according to symptomatically, and this patient requires mercurius solubilis according to symptom similarity. Because the tongue is large flabby, there is salivation, profuse salivation, the tongue is large flabby, and this is a syphilitic, miasmatic dyscrasia. So syphilitic medicine we may think of generally. So let's prescribe mercurius in 50 millisimal scale of potencies, and let's see the result, my friends. I do like to prescribe mercurius for this patient. One, two, three, four, 5 with the directions of BD, and let's see the result, my friends. I shall share with the result of this patient, whether this medicine can decrease the creatinine level in the blood.